Greetings and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. I am your host, Indrias Kassaye, and you are listening to Season 2 of the SAMHSA Minority Fellowship Program at the American Nurses Association's podcast, where we spotlight MFP fellows and alumni and their pioneering work to improve health outcomes for marginalized communities. We have so much to explore, so let's get started. Greetings, Griselle, and welcome to Mental Health Trailblazers, Psychiatric Nurses Speak Up. Let me start our conversation today by asking you to introduce yourself to our audience.
Hi, my name is Griselle Estrada, Griselle Batista Estrada, and I am a nurse educator at Baylor University. And I'm also a mother and a wife and a sister and a daughter and a lot of other things.
A human being.
A human being whose platform is nursing.
And how did you get onto that platform? If you could tell us about your journey, where it began.
So my journey in nursing actually didn't begin in nursing. And this, I think, says a lot about the experience of many Latinxes, Hispanics, Latinos in this country. I did not have exposure to anybody, a role model who was a nurse. And back in high school, I really loved math. And so actually, I was going to start out as an accountant because I loved numbers. But then figuring out that that really wasn't my passion, I wanted to go into medicine. And in my journey in pre-med, I ended up working as a receptionist for a cousin of mine who happened to be the first doctor with his subspecialty on the island. And I saw how busy he was and all the effort he was putting in. And I decided medicine was not for me. And so that's how I fell into nursing. And it was actually the best thing that could have happened to me. I think nursing has opened up a lot of doors for me in my journey.
But have you found that it is actually less stressful?
I think back then when I was comparing him, he was starting his practice and I was very influenced by that. And I was like, I want to have a family and I want to have like weekends off. But no, there's a lot to do in nursing, depending on which journey you take. I think when I first started in the hospital, obviously I had days off and I can leave, things at the hospital. But now in this role, yes, I'm busy all the time, but I love it. I'm a very driven person, so I like to stay busy.
You're also in particular looking at psychiatric and mental health. What led you to that focus?
I started out as a med-surg nurse, actually in Puerto Rico. That's where I got my BSN degree. And I worked there for about a year and continued in the med-surg arena, on a unit floor, in home health, just doing different things. And as a nurse, a lot of people approached me. And I was a leader in my church. I did a lot of volunteer work at church. And I found a lot of people approaching me to ask about their mental health status. And in trying to research and find resources for people, this was back in Miami, it was a challenge for me to find Spanish-speaking mental health providers, even in Miami. And especially if people were specifically looking for faith-based mental health providers, that was a challenge. And, this was back in the 1990s. And so in that, I just felt a calling that I wanted to actually become a counselor. I was going to do my master's in counseling and in psychology. And talking to one of my psychology professors, I told her I was a nurse. And she said, well, why don't you become a nurse practitioner? And again, I didn't have a role model then. So I didn't even know what a nurse practitioner was. But when I started looking into it, I was like, well, of course, this is what I need to be doing. So I became a psychiatric nurse practitioner and I did a little bit of everything, trying to figure out what I wanted to do with that role. But currently, my role is a nurse educator. I discovered that was my passion. I really love to teach. And so I'm not currently working as a psych nurse practitioner. I am a nurse educator.
And how has being American of Puerto Rican descent influenced your career decisions, your scholarly pursuits?
Well, I am glad you asked that question because I am very proud to be Puerto Rican. I live in the Southwest now, and it's kind of a challenge because people they assume maybe from Central America. And so I have to always kind of, explain, no, I'm Puerto Rican, especially with a name like Griselle. It's interesting because Griselle is a very common name in Puerto Rico, but not, in this area. So I'm always having to explain, this is my name. A lot of people, it's a hard name to pronounce. But I was actually born in Puerto Rico. My dad worked for the National Park Service, so we moved around a lot. So at the age of 8, my family actually moved from Puerto Rico And our first location was the Grand Canyon. And so we lived there for a little bit. And I lived in Arizona, Tennessee, Texas, New York. We were living in Texas, actually. And by then, I was almost 15, and my family decided we were going through a lot of hardship related to discrimination. And so my father asked for a transfer to return to Puerto Rico. So I finished high school there. I returned, and it was a hard cultural shift. It was a hard cultural shift moving to the States. And I remember having to learn, certain words in English, and then moving back to Puerto Rico and having to relearn some of the Spanish. But I finished high school and I did my undergraduate there as a nurse. I love my island. I love being Puerto Rican. I'm proud of being Puerto Rican. And so when I started kind of researching information about Hispanic mental health or Latinx mental health, compared to other Latino Hispanic subgroups, and there's only been a small amount of research done to compare these subgroups, but Puerto Ricans had higher rates of lifetime psychiatric disorders, reporting lifetime suicidal ideation, lifetime suicidal attempts when compared to other subgroups. And so that interested me. Obviously, I'm Puerto Rican, so it concerned me. And so as I got into the literature, I was like, I really want to focus on this. And I actually had a hard time. And I remember having conversations with my chair. Should I focus on the whole population or should I focus on the subgroup? And I'm really glad I decided to focus on that, because I think especially after Hurricane Maria hit Puerto Rico in 2017, a lot of disparities became very obvious to me. And I said, no, I have a platform, a unique platform, and I need to be using that platform to advocate for just Puerto Rican mental health issues. There isn't a lot of research done on Puerto Rican mental health on the mainland.
And just to give us a little bit of a sense of perspective, like how many people are we talking about? And what percentage of the overall Hispanic Latino community is Puerto Rican?
So actually, a lot of people don't know that Puerto Ricans are the second largest Latino Hispanic subgroup in the nation. There's about maybe almost 6 million living on the mainland and about maybe 3.2 million on the island. And that has been a big shift because traditionally there were a lot more living on the island than on the mainland. And there's been a huge, like a moving of people from the island to the mainland. And one thing I will say about Puerto Ricans, and just to give a little bit more information. So out of all the Latino Hispanic subgroups, Puerto Ricans are the only ones that are born with American citizenship, which makes our ethnohistory very unique. A lot of things that happened after Hurricane Maria hit the island. And so, and just to provide a little bit more perspective on that, after the hurricane, a lot of people moved to the States because there weren't jobs. The education setting became really difficult because a lot of students weren't going to school. And just the economic issues that have been going on for a while, there was a change at a certain point in time. And then we ended up with more Puerto Ricans living on the mainland than on the island.
As a Hispanic, Latino, Puerto Rican woman in a field that's dominated by white women, as nursing is, what are some of the challenges that you have faced, and how have you navigated them?
So it's interesting. And again, going back to those enclaves, I came from Miami and I was one of many, but living in the Southwest now, it's different, especially where I live and work. It's different. You don't see as many Hispanic or Latino nurse educators in nursing. And in this area, I am one of very few, especially when you look at psych mental health specialty. I am one of very few. And I think for me, one of the challenges for me is having to provide information about Puerto Rico. I had one person one time, and this was after Hurricane Maria. This person was going to travel to Puerto Rico and asked me, what is the currency in Puerto Rico? And I said, the US dollar. And the person said, no, but like the local currency, what do they use there? And I said, the US dollar, because we're a Commonwealth, we're part of the United States. And so that kind of, thing and having to explain, I've had, people kind of confused that going to Puerto Rico is international travel when it is not. It's domestic. I have a US passport. It's not international travel. Something that came up, at least for me, after Hurricane Maria is this aspect that a lot of Puerto Ricans have expressed that being U.S. citizens, in a way, we're treated as second-class citizens and maybe don't have that same equity as regular American citizens have. And how does that impact your approach? How does that impact, the way that you see yourself within the United States and as a Puerto Rican, and then, with other Hispanic subgroups? At the same time, I think for me, it has given me a strong platform to say, you know what? Because of my background, I have privileges that other Hispanic and Latino subgroups don't. And as a nurse educator in this area of Texas, I've become very aware to the challenges in immigration, the challenges for students who are first generation, who have not had role models of nurses or maybe even Hispanic or Latino nurses in their life. And how does family view nursing school? How does family view the role of a nursing student within the family and all that they have to do to support the family? And it just lit a fire in me that I need to use this platform to speak up, to advocate for these students, to advocate for the Puerto Ricans, not just Puerto Ricans, but the health issues that relate to Latinos and Hispanics, because there aren't that many of us who are doing it. And so I feel a strong burden to speak up and say, hey, this is what's going on. These are the stats. We need more representation, and representation matters. We need to be able to have more educators in nursing, more psych mental health providers who are Hispanic or Latino, to be able to help, with those connections and just knowing the culture and raising awareness about those cultural nuances. It's not just, the language, even with that, the language among Hispanic and Latinos, we speak Spanish, but I always use this example. It's like comparing somebody from Ireland, somebody from Australia, and somebody from the United States. Yes, they speak English, but there's a lot of terms that are different. The cultural backgrounds are different. And I'll share a story. I was the faculty advisor for a Hispanic Student Nurses Association at a state university. And I was a speaker one day, and I don't know what I was referring to, but I was going to ask the students, and I said, how many of you love salsa? And there were about 30 in the room. How many of you love salsa? And about maybe 20 of them raised their hand. And then I said, how many of you like reggaeton? And about 3 raised their hand. And then I had a student of Mexican-American descent, and she said, wait a minute. Are you referring to salsa or salsa music? And it was just like, oh my gosh, no. Let me ask that question again. How many of you like salsa music? The majority of the students were from either Mexican or Mexican-American. And so it was interesting when I said, how many of you like salsa music? Maybe 3 or 5 hands went up. And I recently did this I asked this question to a couple of students. One is from New York, Puerto Rican, Dominican background, and the other one is Mexican-American. And I asked the same question. And so the one from Puerto Rican, Dominican background thought I was talking about salsa music. And then the other one assumed I was talking about salsa. And even recently for me, and this goes again, to the cultural nuances, I went to the doctor, and she provided some health education, written health education for me, for my diet. And so she mentioned about limiting the amount of tortillas that I eat. But Puerto Ricans don't eat tortilla. That's not a staple in our diet. And so even things like that for health teaching beyond mental health, like the diet issues, even words. I did a study one time some years ago, and being able to just nuances in the language where verduras is a word, and verduras for some people in some countries, Latino countries, means greens, salads. But for me and for other Puerto Ricans, verduras are starch, the roots that we eat. And so when you do teaching about that, then you really need to understand how does that group refer to certain foods? What foods do they eat? The values and beliefs that they have in relation to, diet and health and well-being, exercise, all these things that, to me, that's kind of what drives me, is to shed some light. If we're going to be providing culturally congruent care, we need to have information about about the different cultures to inform the culturally congruent care.
Yeah, absolutely. Very important point. Thank you for that, Griselle, and we will be right back. You are listening to Mental Health Trailblazers, Psychiatric Nurses Speak Up, brought to you by the SAMHSA Minority Fellowship Program at the American Nurses Association. You can learn more about this unique program that provides support for psychiatric and mental health nurses from underrepresented backgrounds pursuing their master's and doctoral degrees and how to apply at emfp.org or email us at mfp@ana.org. Welcome back, Griselle. For your PhD, you've been exploring transcultural nursing, and this is something we touched on a little bit earlier, but I wanted you to please explain what that means and why it is important for addressing health disparities and health inequities.
So when we look at culture has to do with the values, beliefs, practices that people have that are informed and are transmitted, in a group of people. And culture will influence people's actions. It will influence, specifically looking at health and health behaviors, it influences that. So for me, I think also because of my Puerto Rican background and moving around a lot, I'm an observer of people and I love hearing people's stories. And to me, it's an important part of who people are, is understanding that culture does influence health. And interestingly enough, there's a lot of emphasis on culturally congruent care, but I find in certain areas of nursing, and I'll focus on my area, with suicide prevention, there is a dearth of research focusing on the different Latino and Hispanic subgroups and understanding how the cultural values and beliefs influence the way people talk about suicide or what things they think about suicide prevention.
Looking at death by suicide in general in America, over the past few decades, rates amongst Black, Indigenous, and other peoples of color communities has been increasing. So your research is quite timely. Tell me more about what led you to study this specific topic for your dissertation.
So I worked, as I mentioned, at a state university and in the student success program. And in talking to students and doing a lot of collaboration with counseling, I learned that suicide was the second leading cause of death amongst, at that time, college-age students. And realizing that as a psych nurse, in my perspective, we don't talk enough about suicide and raising awareness about suicide. And so as I was trying to focus on my research interest for dissertation and looking at just Latino and Hispanic populations, I found that suicide was one of the leading causes of death for the Latino Hispanic population in the US. And it kind of waved between, in recent years, the 9th and 10th leading cause of death, which, it's one of the top 10. And I wasn't aware of that. And as I talked to other people and other, Hispanics and Latinos in nursing and just, in my circle of influence, a lot of people were not even aware of that. And I'm thinking, if people aren't aware of that, then how can we promote suicide prevention and what is going on and how people are talking about it, that people aren't aware of this? And again, going back to, I think, my years of service in the church as a volunteer, again, and as a nurse, that a lot of people will come to me and ask, and then these topics come up. Especially in recent years, it has come up more from parents. How do I talk to my children about this? Or I'm having this issue with my adolescent. And realizing that parents were not really equipped to talk about these topics, to understand these topics. And historically, in suicide literature, the rates for suicide attempts historically were significantly higher for Latina, Hispanic adolescents. And historically, there was a lot of focus that was given by certain researchers on that and what was going on. And so one of the aspects of it was this cultural, how can I say this? The culture of the parents who maybe migrated from a country and the culture of maybe this adolescent generation that was either born here or came as children, and how they have to, there's a researcher called Louise, and he said that you have to straddle between the culture at school and the culture at home and the challenges that brought. And that's what I was seeing with the parents that approached me about concerns, that there was this gap that they weren't understanding and weren't getting. And I think as a bicultural, I consider myself bicultural. I lived through certain issues where my mother and my father came with these strong cultural backgrounds from Puerto Rico, but I lived in the States from the age of 8 to 15. And there were other things that I was picking up at school and I didn't consider fair. I'll give an example, and this is funny. A lot of people don't know this, but I think a lot of Puerto Ricans will relate to this. Sleepovers. My mom did not allow sleepovers. And that is something that is very common in the States. And that was a battle, not as much for me, but my siblings. And it was something that was really hard. And so when you look at, and that's just something minor, but dating and other things and how, Hispanic or Latino parents look at it. And then you've got these children that are adolescents, and there's that struggle there. And how does a family navigate this to promote, open communication and support? So I think that's kind of what drove this research. And then specifically, because I was interested in Puerto Ricans, there really isn't a lot of research out there on the cultural factors that influence how people speak about suicide prevention, or just having research that can inform public health measures, especially universal health measures, when you're talking about gatekeeper teaching and teaching people how to talk about this and how to identify people at risk. There wasn't a lot. And so that's why I did my focus on that, because you have to start from understanding how people talk about it so that can inform then the interventions.
So the protective factors of culture and family begin to break down and they become more and more at risk of all the other dangers that are out there.
And that's a good point to talk about the protective factors as well, because there is resilience in the Latino and Hispanic culture. And when I look, at data for Puerto Ricans and let's say even like Puerto Ricans on the island and suicide rates compared to suicide rates in the States, they aren't as high. And so that's another interesting thing for me. And what are those factors that promote resiliency in overall the Latino and Hispanic culture? In my research and talking to the informants and just the strong sense and the strong significance that they gave to family. And Luis Sayas spoke about this in his research with suicide attempts among Latina adolescents, how it can be a double-edged sword. And so my informants also kind of alluded to that you have this strong sense of family and what family means, and that family has this responsibility for support, for care. And then at the same time, if you have a member within that family who's going through something, and that it can be difficult then to open up within the family and bring that issue into the family. And how will the family see it? And how will the family be impacted? Especially, examples like, will my mother have a heart attack if I share this? Something like that. So it is, there's that issue when you have open communication and that care and support within the family. But then if you don't have that, and how that impacts the individual as well. So yes, family is a strong cultural value and it's a strong source of support. But then when that isn't there, or there's a lot of dysfunction in the family, then how does that impact the different individuals within the family and how they address these issues?
There's a lot of stigma and taboo around these subjects. So I'm curious how it is within the communities that you're researching and how that has affected your ability to do research. I mean, are people forthcoming?
So in my research, I interviewed 27 informants, and interestingly enough, they were very willing to speak about these issues. Yes, the word taboo was mentioned, that it was a topic that really isn't talked about. I asked where that came from or what the taboo is, and they really couldn't define it. They just said it's just not talked about. And so at the same time, these informants said, we need information. Like, this is an issue. We know suicide is an issue. There was concern for, a lot of them spoke about concern for the younger generation and adolescents. They spoke about bullying at school and how that can influence mental health. And so there was this balance of saying, this is, taboo. It's not spoken about. But at the same time, we need information. This needs to be spoken about more. Church was identified as a place that should have a role in suicide prevention and in speaking about this in social media. So they were stressing the need for information in this area, which surprised me because I thought maybe, they didn't want to talk about this, or it's a taboo topic, or maybe it was frowned upon. But interestingly enough, they stressed the need to raise awareness about this. One of the issues that came up in my research, how the care that is provided needs to foster something that is called confianza. And there's not a direct translation to the English in this. And it has come out in different areas in the literature. But some of my informants translate it as trust, trustworthy. Are you able to help me? So it's a combination of, do I believe that you have the capacity to help me? Can I trust you? Is this a safe space? And how that influences, how they believe that could influence when people seek help and are able to open up. And to me, one of the interesting things when I asked was, coming from the perspective of gatekeeper training and as a nurse and as a psych nurse, we ask, straight out, are you having thoughts of death? And we teach people you need to ask the question. And so when I brought that specific topic up, many of them said, you have to be careful with that. You can't be direct. There's a relationship that has to be established. There's that confianza that has to be established. And to me, that's something for nursing to think about, how we teach about suicide prevention and how we approach the assessment piece, and are we considering, this issue of confianza and that personalismo in care, and establishing that relationship where my informants were saying just how the expectations they have of care, and that was one of them, to take the time to get to know me, take the time to ask where I'm from, take the time to make a connection with me before going into something like that. And so that's kind of, ideas that I have for the future, looking at gatekeeper training or raising, awareness or teaching about suicide prevention. Are people going to be responsive when we say, you need to ask the question? And, from their cultural perspective, it's like, no, that's too direct. Like, we need to go, in a roundabout way.
Yeah. Which brings me to my next question about where people get their information about suicide prevention. Like if there's a family who might not be hearing about suicide prevention from their circles or in their church, and something happens, whenever there's a story in the media about suicide, broadcasters immediately followed up with a story, with an announcement for suicide prevention hotlines. If you know somebody who's struggling with this, call this. What happens with Hispanic, Latino communities when they call these hotlines? Are they getting that kind of, that confiance, as you said? Are they getting that kind of culturally congruent care?
The National Suicide Prevention Lifeline is a network of different crisis lines and from across the nation. And I've called there myself just to ask these very questions. So they have trained counselors, trained people who are able to talk through situation, provide support to somebody who calls in a moment of need. And they do have people who speak Spanish in those centers. Interestingly enough, this summer, the new line for the crisis line is going to be a 988. That is the number. And it can be through a chat option, text, calling, just like 911. It's very easy to remember for an emergency. So that is going to be the new number, 988, starting, I think, in July of this year, and which I think is great because it's very hard to remember 1-800 number. And I think it just improves access to people. And one thing I want to mention, because I've done this myself and I've had referred the Lifeline to other people, it's not just for people who are going through struggling with suicidal ideation or thinking about, suicide attempt or having a plan. It can also be for people who are concerned about somebody. And so I've had situations where I've given the number to somebody to call, and then they've been able to help that person problem solve through the situation and then kind of identify next steps in the situation. So it's a tremendous, tremendous resource. I think for, at least in my research and talking to informants, it was the need for knowledge, not just about suicide prevention, but about the resources that are out there. That's the piece where I think people are needing to know, okay, there's this Lifeline, but what other resources out there? Who can I go and talk to about this? And I think there's a tremendous need for that. I do want to acknowledge that this is a heavy topic, that it is hard to talk about this. And I don't know, there's people out there who have had a loved one or somebody close who has attempted suicide, who has died by suicide. And that's one of the things I want to actually bring up. There's a lot of stigma surrounding that, people committed suicide, and the people working in this area have made a point and just want to encourage, and I want to encourage people, the way that we talk about suicide. When we say somebody committed suicide, it sounds like a crime, and there's a historical, explanation for that. But the correct term to say is somebody died by suicide. And I do want to acknowledge that it's a heavy, heavy topic, that if you have gone through something like this, to reach out to your sources of support, reach out to that national, suicide hotline, the people that are there to support you. There's mental health providers and different people in the community. It's important to be able to find those safe spaces to talk about this. So reach out to the sources of support that can do that for you. Be it that you're struggling with that yourself, we're living in tough times, or somebody who has lost somebody to this or has been touched by suicide in some way. And that's part of my passion in this, that to me, when I look at this, it's preventable. It can be preventable in so many ways. And we need to really, be talking and raising awareness about this. And I mean, my heart is for the Latino and the Hispanic population, because there is a need for education in this area and providing these safe spaces. It's preventable. We really need to talk about this and provide that support to the families and the people who are struggling with issues that can be risk factors for suicide.
Yeah, very important. Okay, thank you, Griselle. We'll be right back. You are listening to Mental Health Trailblazers, Psychiatric Nurses Speak Up. There is a critical need for students of all underrepresented ethnic backgrounds to pursue graduate degrees in psychiatric mental health nursing. The Minority Fellowship Program at the American Nurses Association is a federally funded program designed specifically to provide fellowships and mentoring support to students from all underrepresented ethnic backgrounds pursuing master's and doctoral degrees in these fields. Visit emfp.org to learn more and apply. Welcome back, Griselle. And on to a lighter tone here. I would like to ask you a few questions, rapid fire style, so in tweet-size sound bites if possible. Who is your nursing hero and why?
Nursing hero, I will just say my heroes are my parents. First, my mother, because she introduced me to my Christian faith and my love of God, and my father, because he introduced me to the love of reading and the value of education. And I'd like to share a quick story in that regard. My dad came from a really hard background. He was one of those initial groups of Puerto Ricans who moved to New York. A lot of discrimination issues that were going on in the 50s in New York. And his father did not go to college, but placed a high value on learning and education. And my grandfather, his father, was a groundskeeper at the Botanical Gardens of the University of Puerto Rico, where I got my BSN degree. And he was able to attend my pinning at the University of Puerto Rico. And it was amazing for all of us. And even for me to see my grandfather came from this, and because of the seeds that he planted, and then my father and mother planted in the value of education, that he was able to see his granddaughter graduate at the University of Puerto Rico.
And what do they say now that you're almost at the end of your PhD studies?
The main question is, when are you going to be done? Okay. But mostly it's pride that I've taken that value this far.
Very well earned. And yeah, congratulations on all of your accomplishments. What has been the best moment as a nurse?
Best moment, I think, is my work with Latino and Hispanic students. Being able to serve as a role model, being able to encourage them. I think specifically that, to encourage them, and then seeing them meet their objectives to go on to further their careers, their education. That to me just fills me with pride.
And the worst experience as a nurse?
There are many worst experiences in nursing. I'll say nursing is a difficult profession. It's so rewarding, but it's very challenging. There's not one that I can say. I mean, the challenges of working with different people and trying to understand where they're coming from. I think I wouldn't call it worst. I think my burden right now, again, is the need to have more representation in different circles of having Hispanic nurses, Latino Hispanic nurses. I think that, no, I'm not calling it the worst moment. It's the burden on my heart right now is to have that representation.
Okay, next question. Any pet peeves regarding how mainland Americans perceive or understand Puerto Rico?
I think it's that understanding that Puerto Ricans are American citizens. I think especially in this area where I am now in the Southwest, Puerto Ricans in general don't eat spicy food. And so I'm always having to check here in the Southwest, in Texas, that spicy food, I don't eat spicy food.
Where do most people get their information about Puerto Rico?
I don't know. I don't know where people get I honestly, I think that's the issue. Maybe there is not enough information. I think some information came out after Hurricane Maria just because of the huge, tremendous impact that there was on the island. But I find that, no, that's something that is a need to continue to be spoken about, the issues of the island.
Finally, then this is an issue that we've been dealing with at work. And I think maybe the whole country's been wondering what's going on. We have Latino, Latinx, or Hispanic. Which one should we use, in your opinion, and why?
I think the bottom answer to that, use the one that you are comfortable with. Latinx is just a term that came up in recent years to provide a gender-neutral term, maybe for people who are non-binary, who identify as non-binary. So it's a gender-neutral term. Pew Research has had studies put out and information put out on that. When you talk to Hispanic and Latinos, they would rather identify by the country of origin. So when you talk to me, I don't identify as Hispanic or Latino or Latinx. I just say I'm Puerto Rican.
Thank you very much, Griselle, and we will be right back. You are listening to Season 2 of Mental Health Trailblazers, Psychiatric Nurses Speak Up, showcasing the inspiring journeys of emerging nurse scientists addressing the unmet substance use, psychiatric, and mental health challenges facing marginalized communities in America today. The SAMHSA Minority Fellowship Program at the American Nurses Association is a federally funded program awarding fellowships to nursing students of all underrepresented racial and ethnic groups who are pursuing either a master's or a doctoral degree in psychiatric mental health nursing. To learn more about this program and how to apply, visit emfp.org. Welcome back, Griselle. So self-care, it was a subject that you mentioned when we were discussing previously or prior to this podcast was really important for you and important for nurses in general, healthcare workers, especially during this time, COVID and all the stress that everybody's going through. What does that mean for nurses, and why has it become so important for you and more pronounced in your work as a nurse educator?
In my work with nursing students as a nurse educator, I saw how students put a lot of pressure on themselves and they're high achievers. And I think in general in nursing, and I certainly qualify myself as that, being perfectionistic, having a lot of expectations on myself, and how that drives you and the culture within nursing where a mistake can literally lead to somebody's death. And all that pressure, how we are focusing and we talk about patient safety, and where does, the nurse come into that? And I think there's a need to continue to talk about self-care that goes beyond, going to a massage, exercise. I think there's issues that we have to, address about boundaries and how we are able to consider the health of the nurse and the well-being of the nurse. I had a student ask me, she said, we talk about patient safety so much, and that's like the number one, that's the answer that always students say, safety, patient safety. And then she said, where does nurse safety fall? Is it the same? Is it higher? Is it lower? And that led to an incredible discussion about self-care and how we can put the needs of a patient, ahead, and we have to put on our nurse face. But then how do we talk about the humanity of the people who are nurses and their needs, and how we kind of talk about that at the same level of patient safety?
Yeah, absolutely. And I think it goes hand in hand. If you're not your best self, then especially given the holistic nature of nursing and the amount of time that nurses spend with patients, it's not like a 10, 15-minute visit from a doctor. It's so important that you are at your best.
And I think for me, actually, this journey as a PhD student was what really highlighted this, that I realized that I did not see my own humanity, and in learning to grant myself grace, that I had these really high expectations that I may not put on other people, but I put on myself. And that has been a challenge in this PhD journey, but it's been a huge lesson that now the way I teach, it influences the way I teach, the way I interact with other people, and just the space that I grant myself in being able to say, I need to focus on this now, or maybe put the brakes on this now, or say no to this, or, the importance of downtime. Downtime is so important because I tend to be like, let's fill up the whole day with stuff. No, I just need downtime to just think and process what has happened throughout the day.
Absolutely. To be mindful and meditate. Well, then that's a nice segue to my next question, which is about your role as a minority fellowship program fellow. How did you find out about the fellowship program, and what role has it played in your studies, in your scholarly pursuits?
Oh my gosh. I was researching all over the internet looking for funding for my PhD studies, and I found this program. But at that time, one of the requirements was to be actively in working as a psych nurse practitioner, and I was not at the time. And so I've been very involved with the National Association of Hispanic Nurses, and I met Janet Jackson, who happened to have a booth there. And I had a conversation with her, and she said, actually, this year we're making changes, so you can go ahead and apply. And that's a little plug for professional organizations, especially an organization like the National Association of Hispanic Nurses, that a lot of nurses are not even aware that we have that. That's one of the reasons why I decided to do my PhD. A speaker that I heard at the National Association of Hispanic Nurses, who was Puerto Rican, who shared her journey and encouraged, Hispanic nurses to use their platform. And I realized I have a very unique platform as a Puerto Rican nurse and as a Puerto Rican nurse educator, and I need to use it. And so to advance my education further. And so even in non, I decided to do my PhD in a non-conference. I met Janet Jackson, and I mean, that's funny. She's the program director, but Janet Jackson opened the door for me and was able to give me, some tips and what they're looking for in a candidate. And it has just been the MFP. I cannot speak highly enough of it. The support that I get, those intensives that really opened my eyes to different issues that I didn't even know I needed to be aware of that. And that's one of the things of advancing your education. You become aware of these issues that really need to be addressed and highlighted, and how you need to be educated in certain areas to be able to use that platform and to advocate for people and to inform people of situations. I'm always talking about the MFP. Anytime I hear about anybody doing their masters or, I'm like, hey, forwarding. And I think another point in thinking, because I've been doing this too, is raising awareness within the schools of nursing about this program. And so where I've been teaching and studying, I've been able to raise awareness as a fellow and saying, hey, there's this program, let's promote this amongst the students who are in, the psych nurse practitioner program, or, somebody's doing a PhD or a DNP related to mental health issues. So even within the schools of nursing, how we can use our own fellows to kind of, promote the fellowship within different schools of nursing across the nation.
Thank you, Griselle, for your time. I have taken up quite a bit of it. I know that this is a very busy time for you as the semester winds down. So thank you very much.
Thank you for inviting me to participate in this.
Absolutely. It's been a pleasure. And that does it for this episode of Mental Health Trailblazers, Psychiatric Nurses Speak Up. I hope you've enjoyed our discussion, and I look forward to you joining us on future episodes. This is the Minority Fellowship Program at the American Nurses Association podcast, featuring nurse scientists addressing the psychiatric and mental health issues affecting underrepresented communities across America. You can always find us online at emfp.org and wherever you get your favorite podcasts. The views expressed by the speakers and host do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government.